In the 2025 scientific report for the US Dietary Guidelines, the ongoing cap on saturated fat, which restricts intake to less than 10% of daily calories, this still remains. In the opening paragraph, the advisory committee states, and I quote, "Guidance has been informed by a large body of consistent, high-quality evidence on the role of saturated fat in the development and progression of cardiovascular disease." That's not what the evidence suggests. To summarise, in terms of cardiovascular risk, there is no evidence to conclude that high-fat dairy should be replaced with low-fat dairy. There is no evidence to conclude different amounts of saturated fat or any amount of saturated fats in red meats are problematic, similarly for white meats. There is no evidence to conclude processed or unprocessed meats, including red and white meats, increase risk of cardiovascular disease. There is no evidence to conclude that plant sources of saturated fat increase risk in comparison to meat. There is no evidence to conclude that plant-based foods higher in saturated fat are better than meat consumption. Overall, the advisory committee found no consistent associations between saturated fat intake and cardiovascular outcomes. There certainly is no strong, consistent, high-quality evidence as suggested in the opening statement.